Hi, I'm Taylor and I'm a second year MPH student at Columbia. One of the big questions that I get asked, especially around the end of fall and beginning of spring, is about applications and the application process and how to prepare, what you're going to need, things like that. So I have made myself a mock application and I'm going to talk through the process. So applying to public health schools uses a system called SOFUS, and the actual look of it and the user interface of it is very, very similar to AMCAS. It's probably the same backbone of an application portal. And so there's some four main things that they ask you about. So there is your personal information, your academic history, supporting information, and program materials. And along with that, you also have to make your program selections. So the way that I approach applications, and this preparation works for any big application that you're doing, is number one, having everything done as soon as humanly possible. I know sometimes life happens or decisions get made later and you don't always get everything in by super early priority deadlines and everything like that. So but if at all costs, if you can, get everything ready as soon as possible, especially your letters of recommendation, but we'll get to that in a minute. So your personal information is pretty self-explanatory. To prepare for that, make sure that you have all of your previous addresses that you've ever lived at. Some application systems will ask for all of that, some won't, but it's always better to be prepared than not. They'll also ask you some questions, obviously demographics, things like that. One of the really big chunks of the application is the academic history. So you not only have to upload your official transcripts, but you also have to manually enter every single grade. And this can be really time consuming, especially depending on how long you've been going to school, how long ago it's been since you've been at school. So definitely get a hold of your transcripts, your official transcripts, as soon as possible. Order yourself a copy. That's what I do. I order myself an unofficial copy when I'm ordering the official copy to get sent to SOFUS, and that way you're just entering exactly the way that it is on your transcript, and there's no questions later when they're verifying everything that you've entered the same information that they were sent on paper or digitally, depending on how the school does it. I think though that SOFUS, you're able to send a digital copy of your transcripts. And obviously that costs money. The whole application process costs money, but that's another story. So in your academic history, you also have, so obviously the schools attended, your transcript entry, and your standardized tests. So I only applied to MPH programs that took an MCAT score because I had already taken the MCAT and I did not want to take another standardized test. So I was able to apply to 7 programs, and there was way more than that would have accepted my MCAT score. So if that's something that you're looking at, don't worry about it if you're going to public health school. Obviously, if you're applying to medical school, you got your MCAT score. You already know that. But MCAT, GRE, whichever you're using for public health school, MCAT for med school, it's all the same process. Like I said, it's the same exact backbone of an application system for AMCAS too. So the third component is then the supporting documents. So number 1 on the agenda here is the letters of recommendation. You want to give your letter writers plenty of time. Remember that you are asking them a favor, you are asking them to do something for you. You should be as polite and considerate and as thankful as you could ever be, because they obviously get a lot of requests. And yeah, so I have a whole system for going through asking for letters of recommendation, and once you ask them and once you submit the link to them through the application portal, so you'll put in their email and their name and everything, and you'll submit that through SOFUS or AMCAS or whatever application portal, and that will send them an email. So as soon as you've done that and properly asked them, then you're also it's on them. You definitely should follow up, So the other main component of the supporting documents is your experiences. So you'll enter the type of experience, so employment, research, volunteer. AMCAS probably has different options, but they'll give you a little drop down. You provide the name of the organization, as much information as possible, as well as the amount of hours that you spent doing that thing, which can be really hard to figure out, especially with things that you've done consistently over many, many years. I started using an Excel sheet to kind of document my hours for various things. Obviously, sometimes that falls behind, or you're already a senior and you can't go back and retroactively. A rough estimate is fine. If you're like, oh, I volunteered 4 hours a week for 2 academic years, so 16 weeks in a semester, times 4 each week, times 4 semesters, like that's fine. Like it'll the roughest estimate you can do, as long as like it's as correct as possible and you're not exaggerating. I've heard horror stories about people exaggerating the number of hours they have done something, so just stay truthful, stay genuine, stay as accurate as you can. But that's a tough one. And then obviously you have to write about the experience. So this is actually a really important part, because you want to make sure that you are displaying the importance of that. You only get so many experiences to put in, and so like they only allow you to put in so many, and so you want to make sure that you are displaying that you have put thought into the experiences that you've chosen, and that you've chosen them because you think it's going to make you a better doctor, public health professional, etc. So and reflect that in your writing about it. So make sure that it's tailored to why it's relevant and why it helps you become a better candidate for whatever you're applying for. So applying public health school, a lot of my experience was clinical, and like more like geared towards medical school. It's a little bit easier of a spin going from medicine to public health, but I made sure that all of my descriptions were geared towards why this experience would make me a better public health professional. So volunteering in the hospital turns into understanding like hospital systems, and that it helped me gain a view into how the healthcare system works, and what it looks like from this angle and that angle, depending on the like roles that I was in and things like that. So just definitely like take time writing those. Don't write a novel, they give you a character limit. Obviously don't just write 2 sentences, find your happy medium somewhere close to that character count limit. Okay, so the 4th section is the program materials, which for public health will be different. You'll select for each school, and they might have different program materials. For most, you're just uploading your personal statement that is specific to that school, and maybe answering some questions or like some short essay questions in addition to that. But with the personal statements for public health school, you can tailor an individual personal statement to each school that you apply to, whereas for medical school you just write one big personal statement about why you would be a good doctor and why you should be admitted to medical school. Whereas for public health school, it's why would you be a good public health professional, and also why would you be a good fit for this specific program. So that's kind of like an important distinction between the two. Something that, especially for public health school, you have to also look into before you're ready to even complete all of these materials is that you have to do your due diligence and as much research as possible looking into what programs you want to apply to. So I had this and by the end of it, ratty old like legal pad that I had pulled up. They had like a catalog of all of the public health schools, and I had pulled that up and I had looked through I had, narrowed it in various different ways. One, schools that accepted my MCAT score. Two, geographically, like would I live there? Like would I move there? Would I want to move there? And then, just like narrowed it down to maybe, I don't know, probably a dozen schools, maybe a little more, and then did a deeper dive into their website, looked into their program, things like that. I still remember looking at the little puzzle pieces that Columbia has on their website, explaining how like the core curriculum and their entire curriculum kind of like all fits together. I still remember that. And that was how I kept that straight. Like during the application process, like, oh, Columbia's the one with the puzzle pieces. It's dumb, but that was what helped. So good marketing there, Columbia. But yeah, I mean, when I was applying, Brown was my first choice, and in the end, I was deciding between Brown and Columbia, and I ended up choosing Columbia. Short answer, because they had a health policy department and Brown did not. So that's the short answer to why I chose Columbia, because that's another common question that I get. But yeah, so basically, to recap, the things that you should prepare ahead of time before you even really start. You can start the application, just kind of like look around and double check like that you know what they're asking you for, but you should prepare your transcripts. I mean, well, first of all, you should prepare your letters of rec requests. You should prepare your transcripts. You should prepare your personal statement and your experiences descriptions, and then your resume or CV. So those are the 5 main things that 1, stress people out, 2, take up a lot of time, and 3, should be as perfect as possible. I mean, hopefully you're only submitting this once, whether it's medical school or public health school. The goal is to only have to submit it once and get your acceptance and never look back. So you want it to be the most perfect document. Get as many eyes on it as possible, like I said, and good luck. I hope this was helpful. And if you want to hear more about the specifics of the application process, I can talk about that too. So let me know, thumbs up, like, message on Instagram, whatever you do best, and I'll see you next time.